practitioner doing your physical exam today. Are you ready to get started? Good. All right, I'm going to first start by looking at your hands, inspecting your hands, checking for capillary refill. That was good, less than 3 seconds. I'm going to inspect your head. I'm going to palpate your scalp for any lumps. Good. I'm going to inspect your face. Everything looks symmetric. I'm going to check cranial nerve number 7, the facial nerve. Can you puff out your cheeks? Good job. I'm going to check cranial nerve number 5, the trigeminal nerve, the motor aspect, feeling your masseter and temporalis muscles. I need you to clench your teeth. Good. And then clench your teeth. Good. Strength was equal on both sides. I'm going to feel your temporomandibular joint. Open and close your mouth. Good. No clicking there. I'm going to feel your frontal and maxillary sinuses. Good. No pain there. I'm also going to do the cranial nerve number 5, trigeminal nerve. I'm going to do the sensory aspect. I'm going to grab a cotton ball. You're going to close your eyes and you're going to say now when you feel it. Ophthalmic branch.
Now.
Maxillary branch.
Now.
Mandibular branch.
Now.
Perfect. Thank you. All right. Now I'm going to check cranial nerve number 2, the optic nerve. I'm going to check confrontation. That's your peripheral vision. So I'm going to have you cover your eye like this. I'm going to hold my finger out and you look at me and you say now when you can see my finger.
Now.
Good. And then keep that same eye covered. And then say now when you can see my finger.
Now.
Good. I'm going to check cranial nerve number 3, 4, and 6. That's the oculomotor, trochlear, and abducens. It's the 6 cardinal points of gaze. So you're just going to follow my finger with only your eyes. Okay, now I am going to get my pen light. I'm going to check the corneal light reflex, so just look at me. Making sure that the light shines in the same place on the cornea is good. I'm going to do the pupillary light reflex. Good, pupils are equal and reactive. I'm also going to check the accommodation, so you're just going to look past my shoulder here and then look at this pen light when I bring it up to you. Good. Now I'm going to inspect the external structures of your eyes. Eyebrows, eyelashes are all symmetric. I'm going to inspect your external eyes. Conjunctiva are clear, sclera is white, pupils are equal. All right, now I'm going to look at the internal structures of your eyes. So I'm going to get up close to you here, okay? Checking for a red reflex. And then I'm looking at your macula, retinal background, the vessels, the optic disc, and the ocular fundus. Those all look healthy. All right, now I'm going to go to your ears. I'm going to inspect your external ear. I'm going to palpate your auricle and your tragus. And I'm going to get my otoscope and I'm going to look inside your ears. And the auditory canal is clear and tympanic membrane is intact. Color is pearly gray and it's flat. Cone of light is present at 5 o'clock and malleus is present. Now I'm going to do your nose. I'm going to inspect your external nose. It looks symmetric. And I'll look inside your nose for any bats in the cave. Good job. That looked good. Now I'm going to inspect your mouth. Say ah for me.
Ah.
Good. The mucosa is moist and your tongue is pink. I'm going to check cranial nerve number 9 and 10, the glossopharyngeal and vagus nerve. And so you're just going to open real wide and say ah.
Ah.
Good job. And the palate and the tonsils rose midline symmetrically, so that's good. No concern for stroke or paralyzation. And then I'm also going to check cranial nerve number 12, hypoglossal. I need you to stick your tongue out for me. Good. It protrudes midline, so that's good. And then can you say light, tight, dynamite?
Light, tight, dynamite.
Good job. Okay, and then I'm also going to check cranial nerve Number 8, the acoustic vestibulocochlear nerve. So this is a whisper hearing test, and this is going to test your hearing, okay? So I'm just going to stand like an arm's length away, and then I need you to take this hand and cover this ear for me. Got it covered? Okay, I'm going to whisper 3 letters, and you repeat them after me.
A, B, C.
Good job. Okay, coming back around to the front. All right, now I'm going to inspect your neck. Can you sit up nice and straight for me? Good. Your neck looks symmetric. Trachea is midline. That's good. No lumps. I'm going to feel your carotid pulse. Good. And I'm going to listen to it too, okay? With the bell of my stethoscope. Can you take a breath and hold it for me? Good. You can let it out. Take a breath and hold it. Good. You can let it out. No bruise there. Now I'm going to feel your lymph nodes. So I'm going to feel here pre-auricular, posterior auricular, occipital, superficial cervical, posterior cervical, jugulo-digastric, submandibular, submental. And then I'm going to feel your deep cervical chain. So I just need you to tilt your head slightly when I feel on this side. Deep cervical chain. Good. And then hunch forward just a little bit for me while I feel your supraclavicular lymph nodes and your infraclavicular lymph nodes. Good, thank you. Okay, now we're going to go around to the back. So I'm just going to have you swing your legs that way. Like that. Actually, swing around this way first. So I need to feel your thyroid. Okay, and this is where the water comes into play. Hold that cup of water for me.
Okay.
Sit up nice and straight. Tilt your head down just a little bit and to the left. And so I'm going to displace with my right hand and palpate with my left. Take a drink of the water and swallow while I palpate. Good. And then same thing, just turn your head to the right there just a little bit. Displace with my left hand. Go ahead and take a drink of water. I'm going to feel as you swallow. Good job. I'll take that back from you. All right, and then swing your legs back around this way. Off to that side. And I'm going to inspect your posterior chest. I'm going to feel for any lumps. I'm going to feel your spinous process. I'm going to check for tactile fremitus. So when I place my hand, you say 99.
Okay, 99. 99. 99. 99. 99. 99. 99. 99.
Good job. Okay. And I'm also going to check thoracic expansion. So I'll pinch a little part of your skin here. You take a deep breath in and out for me. Good job. And that was symmetric. Now I'm going to percuss, okay? So I'm just going to be tapping on your back here. And that was good. And then I'm going to listen, okay? So each time I move my stethoscope, you just take a deep breath in and out for me, okay? Do it again. One more. Again. Good job. Now I'm going to check for egophony. So each time I move my stethoscope, you say E.
E. E. E. E. E. E. E. E. E. E.
Good. Now I'm going to check for bronchophony. So each time I move my stethoscope, you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good job. Now we're going to come back around to the front. Now I'm going to inspect your anterior chest. So this is the front of your chest here. I'm just feeling for any lumps. I don't see any. And then I'm also going to percuss. I'm going to do the same thing. I'm just going to tap on you here, okay? And make sure a placement can be seen on this. And that was good. And I'm also going to listen to your heart and lungs, okay? Doing okay?
Mm-hmm.
Good. Okay, so just hunch forward just a little bit for me. Listen to your heart. Good, and then just breathe normal for me. That was good. Okay, now I'm going to inspect your upper extremities, so your arms here. I'm going to check range of motion of your shoulders. So if you could do this for me, up and back behind you, and then up over your head, and then back behind you. Good. I'll do range of motion of your elbows, flex and extend. Good. I'll check strength of your arms too. Okay. So if you could hold my hand and just pull against me. Pull. There you go. And now push against me. Push. Good job. Okay. And then I want to do range of motion of your wrists. So hold your hands out like this. Bend them down and up, in and out. And then close your hands. Open them. Good. And then fingers, just only your fingers down and up. Good. Okay. And then I'm also going to feel your brachial pulse and your radial pulse. I'm going to palpate your axillary nodes and then your epitrochlear node. So I'm going to have you like shake my hand. I'm going to take your elbow like this and feel. I don't feel anything, so that's good. Okay. Now, you ready to lay down?
Mm-hmm.
Okay. Lay down. Get up here on the pillow. Okay. First, I'm just going to inspect your precordium, and then I'm going to feel for any pulsations or thrills. I don't feel any. I'm going to feel for your apical pulse, and that is the fifth intercostal space mid-clavicular line. Then I'm going to listen to your apical pulse. Sorry. Over here. And that was good. Rhythm was regular and rate was 90. Now I'm going to listen to your heart sounds, okay?
Mm-hmm.
I'm going to do that with both the bell and the diaphragm and the bell of my stethoscope. So we're going to start here, aortic, which is second intercostal space, mid-clavicular line. Pulmonic, second intercostal space, mid-clavicular line. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, mid-clavicular line. And I'm going to do the same thing with the bell. Aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, mid-clavicular line. Good. Now I'm going to listen to your aorta. I'm listening for bruits. I'm going to listen to your iliac arteries and your renal arteries. I'm going to do that with my bell also. Aorta, iliac arteries, and renal arteries. No bruits. Now I'm going to listen to your bowel sounds. And those were normal active. Now we're done listening. I'm gonna, you can still sit, lay down. I'm gonna inspect your abdomen. Everything looks symmetric. Now I'm going to percuss, okay? So I'm just gonna be tapping. Good. Now I'm going to percuss your liver span. And this is on the right side mid-clavicular line. I'm just going to percuss down this way until I hear dullness. I'm going to grab my marker real quick, okay? Okay, right there. I'm going to go up. Right there. Gonna mark. We're going to measure it. And it's 6 centimeters for the liver span. Okay, and then I'm also going to percuss your spleen, which is over here about the 9th or 10th intercostal space on the side here. And that's dull. That's good. Okay, now I'm going to palpate, okay? So it's just going to be light first and it might tickle a little. Okay, so light palpation. Any pain? No pain? Good. Now I'm going to do it a little deeper, okay? Good. Now I'm going to palpate your liver. It's kind of up under your ribs here. And I don't feel it. And I'm going to palpate your spleen. And I don't feel it, not palpable. I'm going to palpate your kidneys. Not palpable. Let's move to the other side. Palpate your kidney. Not palpable. And I'm also going to palpate your aorta. Good. All right, now I'm moving on to your legs. I'm going to inspect your lower extremities. I'm going to feel them for any swelling. I'm going to palpate your pulses. So down here behind your knee, popliteal pulse. Here behind your ankle, posterior tibial. And then here on top of your foot, dorsalis pedis. Okay. Now I'm going to do range of motion of your hips. So just with this leg straight, lift it straight up in the air for me, and then back down. Good. Now bend your knee, and then try to lift it towards your chest, and then bring it back down. And straighten it. Good. Range of motion of your knee. Just put your leg up like this, bend your leg, and straighten it out. Good. And you get your leg down. Now I'm going to have you, again, range of motion of your hip. Lift your leg straight, swing it out that way. Good. And then bring it back in. Perfect. Thank you. And then range of motion of your ankles. Can you point your toes up towards yourself and then straighten them down? And then your toes, can you curl your toes, straighten them out? Perfect. Thank you. Okay. Now I'm going to have you sit up. And then scooch down here towards the edge. This is where we're going to do some light touch and sharp touch and soft touch, okay? So you're gonna close your eyes, and you're gonna tell me if you feel sharp or soft.
Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft.
Soft, good, okay. Now, still with your eyes closed, I'm going to take your hand, and you're gonna tell me if I push your finger up or pull it down.
Up. Down.
Good. All right, and then still with your eyes closed, I'm gonna put something in your hand, and you have to tell me what it is, okay? So that's in your hand, take a feel.
Keys.
Keys, good job. Now it's checking stereognosis. Okay, now I'm gonna check your cerebellar function. Yeah, cerebellum function. Okay, so this is where you're gonna do finger to nose, okay? So you take your finger, put it on your nose, and put it on my finger. And then same thing, heel to shin. So you're gonna take the heel of your foot and run it down the shin of your leg like that. Awesome, and then do the same thing on that side. Great job. And then back up here on your neck, I'm gonna do range of motion of your neck. Okay, so we're gonna do this way, side to side, side to side. Good job. Down, up, good. And then I'm gonna check the strength of your neck and of your shoulders. This is checking cranial nerve number 11, the spinal accessory nerve. So I'm gonna have you push against me as I put my hand here. Can you push against me? Good. And then try to push against me again. And then try to shrug your shoulders against my push. Good job. All right, ready to stand up? Okay. Stand up. And we're gonna check the Romberg sign. So you're just gonna stand just like this, straight, close your eyes. Good, I don't see any swaying back and forth. And then you're gonna open your eyes. And then you're gonna walk heel to toe for me. So heel to toe. Perfect, good job. Okay, you can go back towards the bed there. You can stay standing. And you're gonna do a shallow knee bend. So you're just gonna bend your knee like that. And bend your other knee. Perfect, thank you. Now, turn around. Scooch back this way just a little bit. You're gonna bend over and touch your toes, and I'm gonna look at your spine and make sure you don't have any scoliosis. And that was straight. Good, you go ahead and stand up. All right, and face me. We're gonna do range of motion of your spine. So you're gonna do side to side bend, and then rotate, rotate. Awesome, great job. Popped your back, good job. You've been a great patient. So before we end, I want to look at my card just really quickly and make sure that we got everything, okay? So sit back up here for me. And this is my 3x5 card. It looks like I did all of that. Okay, I know one thing that I wanted to do as well, and that was check your reflexes. We've got to do that one. But otherwise, I think we did everything. Yay! And you are an excellent patient. Awesome. Okay, so we're going to do your reflexes, okay? So we're going to do biceps first. Good. And then we're going to do tricep. Good. We're going to do brachioradialis. Good job. We're going to do your patellar. Good. And then we're going to pull this out. We're going to do your Achilles. Good job. And then we're going to do the Babinski sign. Good job. And then the very last thing, and then we'll be all done. On your back here, swing around. Stay sitting up. And I'm going to feel for CVA tenderness. Tell me if this hurts. Does that hurt? Any pain there? No? Okay. Awesome. You can turn back around. You've been an awesome patient. Thank you so much.